are a parent and you have kids, actually of any age, we're talking about substance abuse this morning and why it spikes during certain times of the year, especially in the summertime. We've got Dr. John McCaine joining us this morning. He's a clinical psychologist and also a Lighthouse program supervisor at Bayless Healthcare. And you've got some information for us. So, I mean, we were talking before the show. I told you I have 13-year-old triplets. And, you know, I try to talk about substance abuse and drugs, alcohol, and, you know, you can try to prepare them as much as possible. But why does it spike, and why does it spike in the summertime?
Well, particularly during the school year, the kids are occupied during school, and even they're aware they have to go to school the next morning. So it motivates them to get to bed a little bit early. But the summer break is kind of like the school year on Fridays and Saturdays, where that's where drug use and alcohol use spikes as well, because they're a little less concerned about having to get up early in the morning.
And many times too in the summer, you know, if you're a teenager, the parents are working, so it's like, oh, well, we no longer need somebody to come over and watch you during the day. So now you're by yourself.
By yourself.
Quite often.
Unsupervised, with a whole lot of free time on your hands. That's why it's so important, as we talked, Lisa, that you got to get your kids involved in activities, whatever their natural interests are, sports, chess, theater arts, you name it. It gives them the time to keep themselves occupied during the summer, when otherwise they could get into trouble.
Get into trouble.
Absolutely.
Because they're bored and looking for something to do.
Yes, boredom, looking for something to do, and getting involved in things that for excitement and to connect with friends they missed during school. But you know, the other part we talked about too was the boredom of having too much on your mind. And a lot of times kids have told us in our groups that when they're bored, they start thinking about things they're not happy about, things that they're upset with. And those kids that use drugs, they'll say to chill, but it's really to avoid uncomfortable feelings and things they haven't dealt with.
They have to deal with.
Absolutely.
And plus too, here in Arizona, it's so hot in the summertime. I mean, I'm from Chicago originally, and growing up, I mean, you'd be out the door, and I know times have changed, but you would be out the door, riding your bike to the pool at like 10 o'clock in the morning. It was like, okay, be home by dinner time, 5:30, 6, and then of course, we would swim team and tennis and everything else, and you kept busy. So by like 9 o'clock at night, like, I'm tired.
Yeah, you're tired, you want to go
And there
sleep.
was no computers and internet and phones and all that other stuff, the cell phones as well.
Exactly right.
How do parents talk to their kids about the substance abuse?
That's a great question, because often parents get trapped because of our fears of our kids. We get trapped and tell them, don't use, it's a bad thing. It's better to get into a conversation. Know what's going on and ask your kids, why do you think cigarette smoking has decreased so much in the past 10 years among teenagers? Why do you think, what's this about spice, and what do you know about it? The real key is to keep the conversation going, not just saying, no, don't use it, because as you know, teens are kind of naturally rebellious. You want to have a conversation with what's going on, so know what's going on and know what's happening in terms of drug use among kids today.
Conversation versus like the dictatorship, like you better not do that.
And we all know how well that works.
Right, exactly. And if they're rebellious, guess what? Oh, it can't be that bad, so I'm going to
Exactly.
go and try it. What about if they fall prey to peer pressure?
That's a real huge thing, because a lot of drugs, our kids will tell us this, they use drugs because they want to get accepted, sometimes to impress others. They'll challenge that, oh, are you chicken or afraid? So it's really important that they also are involved in healthy activities so that their peers are also involved in similar healthy alternatives.
As a parent, if your child has already experimented with drugs or alcohol, first of all, tell everybody some signs and symptoms and steps that you can take to hopefully steer them away from that.
The biggest thing is secretiveness. When your kids get defensive about what they're doing, you need to be concerned. Kids often talk about privacy, and you know how teenagers are, you've got emerging teens. So it's not unusual for them to keep certain things private. When they're secretive and defensive, when their diets and health changes, look for weight loss or weight gain. You're looking for anything that's a significant change in their pattern that's going to make you as a parent look up and say, that's different.
Maybe
That's
a change in their friends.
Change in friends is a huge one, particularly, by the way, if they keep their friends from you and don't want you to meet their friends or know who they're associating with. Also, social media. I think parents should know who their kids are connecting on social media, because the things that are going on social media are unbelievable with regard to the exchange and even sale and distribution of drugs. We have to be aware.
And like, oh, well, let me see what's on your phone. I mean, kind of ask them at random times so they don't have, you know, the time to delete whatever it was that they were just texting, or a photo or whatever was going on there.
Absolutely, because privacy is one thing, secrecy is a whole other thing. Kids have private things that are important to them they get embarrassed about. But when they're secretive about things, they don't get embarrassed. They get upset and they get angry, and that's another sign of being aware that there may be something else going on.
At what point, too, as a parent, like, okay, my child is experimenting with drugs and alcohol, does the parent take the next step going, this is now becoming a big deal? And at what point do they reach out and contact somebody like you at Bayless Healthcare?
I would say as early as possible. See, the interesting thing is, if you talk to kids, 30% are using drugs like alcohol and spice. If you talk to parents, only 10% of the parents think their kids are using.
Well, what age are they starting? I mean, are you
They're
seeing
starting
younger and
early
younger?
now. We're seeing kids starting at 9, 10 years old, unfortunately.
boy.
And that's a problem too, because it's more available and more accessible. So I think it's important early on to talk to your kids. Don't wait until you're sure. If you see changes, have a conversation. And if it looks like the conversation not going so well, reach out and ask to contact somebody professionally.
Great information, Doctor. Thank you so much. And if you'd like more information, you can always reach out to baylesshealthcare.com. We'll be right back with more of the Morning Scramble.